The views expressed in this podcast are my own and those of my guests. They do not represent or reflect those of UCSF Health or my professional and clinical roles there. The content is intended for informational purposes only and is not medical advice. Please consult a qualified healthcare professional for specific medical guidance. The holidays are supposed to be festive, but for your heart's electrical system, they can be a little chaotic. More drinks, less sleep, travel days, salty food, and stress. It's the kind of combination that can make even a normally well-behaved heart act up. In today's episode of In the Loop with Nadja Wlasiuk, we're talking about holiday heart syndrome, that spike in arrhythmias, most commonly atrial fibrillation, that can show up around times of celebration, especially with heavier alcohol intake. Joining me is one of my friends and colleagues, Dr. Albert Liu, a cardiac electrophysiologist and assistant professor at UCSF. He treats patients with heart rhythm disorders and specializes in ablations and lead extractions for devices, and he also has a focused interest in sudden cardiac death. In this conversation, Dr. Liu breaks down what holiday heart actually is, why alcohol can trigger arrhythmias, what other holiday factors can push people towards atrial fibrillation, and practical steps that can reduce risk without turning the season into a stress test. Albert, thank you so much for joining us today and for teaching us all about holiday heart. But before we get into that, can you share a little bit about your work in electrophysiology at UCSF?
Of course. Yeah. So I am an assistant professor at UCSF in cardiac electrophysiology. So I treat patients with heart rhythm disorders. I have an interest in devices. So I specialize in lead management and lead extractions. I also do complex ablation, both atrial and ventricular, so the top and bottom chambers of the heart. And I have an interest in sudden cardiac death. So looking at causes of sudden cardiac death and understanding all the different reasons why people might die suddenly outside the hospital.
What initially drew you to study arrhythmias and electrophysiology?
Oh, it was a kind of winding road. I was the type of person in medical school who liked everything.
Hmm.
I liked general medicine. I liked surgery. I actually liked OB-GYN. I think there were a few things. First, in medical school, I started to have my own like arrhythmias, basically. When I was a second year in med school, we had done our cardiology block and I started to have like a lot of palpitations. And
Hmm.
I did, there was this whole workup and it turned out that I had a lot of extra beats from the bottom chambers of the heart, premature ventricular contractions.
Hmm.
And then I later that year developed atrial fibrillation. So there was kind of some personal interest and investment based on the arrhythmias that I had. And then, while I was in med school, I just loved cardiology. I loved the breath. You take care of people who are very sick. You take care of people in clinic and how many tools you have as a physician to treat cardiac disease. And that was what drew me to cardiology first. And then once I was a cardiology fellow, I just loved working with my hands. And electrophysiology is a procedural field. And I just felt like being in the lab is kind of like solving puzzles. Electrophysiology can be complicated, and a lot of people are appropriately nervous around arrhythmias. And I just find them to be fascinating. And I was excited by the idea of the challenge of it. And so I think all of those factors kind of convinced me to become an electrophysiologist.
That's amazing. I love that you have like personal experience with it because I think that makes it more real. And it also, as a provider, it gives you like street cred with the patients because you've experienced it yourself.
Yeah, I think it's very scary, when your heart beats very quickly and suddenly and you don't know what's going on and you don't know if it's really, really serious, something terrible is going to happen. So I definitely get it. I think there can be a lot of anxiety around arrhythmias and no matter what kind. And I really understand that.
Yeah, it's definitely one thing that I love about EP is is that, we can have the ability to take away some of that anxiety, especially for the atrial arrhythmias that aren't life threatening. I can see like the relief on their faces when we explain to
Yeah.
them.
Reassurance goes a long way. It really
Yes,
does. Yeah.
absolutely. And I love that. So tell us what holiday heart syndrome is and how did this term come into clinical use?
So, holiday heart syndrome is such a interesting term, but it was actually first introduced a while back in the 70s, 1978, by this doctor from New Jersey, Dr.
Mhm.
Ettinger. And he published a case series that looked at essentially some patients who, with recent heavy alcohol use, kind of alcohol binges, who presented to clinical care with arrhythmias. And these people had kind of no evidence of prior heart disease, but were coming in with different cardiac rhythm abnormality. And he termed this sort of syndrome holiday heart syndrome. I think one working definition of it might be kind of an acute arrhythmia that's associated with heavy alcohol use in a person without any prior heart disease and sort of maybe disappearing with abstinence.
I love that that's the working definition because I've seen it run the gamut of different definitions. When I worked in inpatient cardiology, I first thought holiday heart was like acute heart failure exacerbation. I didn't realize that it was like arrhythmia based. And then when we actually looked into it, and last year I did a little segment on holiday heart, and I was like, oh, this is interesting. It's arrhythmia with alcohol around the holidays. How does holiday heart though? How does it differ from other forms of arrhythmia?
So I guess first I'll say that, we use the term holiday heart syndrome and it often is clustered around the holidays because people tend to celebrate and drink more alcohol. And so we do see more evidence of these arrhythmias associated with alcohol use, but it can happen all year round. So, someone can binge drink, in March and come in with an arrhythmia. And, I think that could be considered holiday heart syndrome. It's just often clustered around the holidays because of the association with drinking. I think, in terms of how it differs from other forms of arrhythmia, I think maybe one of the big factors or differentiators is that it seems to be kind of this isolated incident where someone, has an alcohol binge or like an episode of heavy alcohol use and then develops an arrhythmia and is otherwise seemingly has, no heart history, no structural heart disease. And then it kind of terminates on its own usually. And then if someone stops drinking, then they don't usually have more of it. Whereas arrhythmias have a variety of causes. Oftentimes, people have clear risk factors or heart disease preceding their arrhythmia. And, some of these other forms of arrhythmias that aren't necessarily holiday heart, because the holiday heart syndrome has this trigger alcohol, we think of it as like maybe it was precipitated by alcohol. And then, if you stop and binging, then it might recede. Whereas, let's say you had an arrhythmia like atrial fibrillation develop not in the setting of alcohol, it might not necessarily kind of have that episodic nature. You might have more and more of it. I guess that's how I would think about it, the difference a little bit. It's very clear trigger, heavy alcohol use, and then it kind of recedes.
Okay, that makes sense. So it's not people who've already been diagnosed with an arrhythmia. This is like kind of new onset triggered by binge drinking. And which I guess we should clarify what is binge drinking definition.
I would probably say 5 or more drinks in one setting is binge drinking, although you can see holiday heart syndrome and arrhythmias with less than that. Um,
Mhm.
but I think, five drinks or more would probably classically be what I would call binge drinking. And then I guess to clarify too, we've been saying arrhythmia. I think the most common arrhythmia that we're talking about when we say holiday heart syndrome is atrial fibrillation. And other atrial arrhythmias are also present, maybe a little bit less common, and usually not arrhythmias from the ventricle, like PVCs or ventricular tachycardia.
Good. Yeah. I had always kind of associated it with atrial fibrillation. I think I'm much more conservative when it comes to binge drinking, but I think of what I've been telling patients is, yeah, not in the context of holiday heart, obviously. The research is that Dr. Greg Marcus has been doing at UCSF with alcohol and atrial fibrillation is that just one alcoholic beverage can trigger atrial fibrillation. There's more association with binge drinking, and I typically say like 3 to 4, but I think the actual National Institute of Health definition is binge drinking typically occurs after 4 or more drinks for women and 5 or more drinks for men. So somewhere in the 3 to 5 range, I would say is probably safe
Yeah,
bet.
I think that's a fair way to put it. Yeah, 4 to 5. Your comment about the single drink and atrial fibrillation is interesting. I think there's been a lot of back and forth on alcohol and how much alcohol is too much alcohol, both for cardiovascular disease, but also atrial fibrillation specifically. And, Dr. Greg Marcus, who you talked about, who's my colleague here at UCSF, has done a lot of work studying the effects of alcohol on arrhythmias and atrial fibrillation specifically. I think the data out there is a little bit equivocal. We know that generally more alcohol means more atrial fibrillation, and that it's kind of a linear curve or a line where you drink more and you're more likely to develop both incident atrial fibrillation and recurrent atrial fibrillation.
Mhm.
But there's some data that shows that maybe below 7 drinks a week is okay. A lot of the studies kind of show that moderate, more than 7 drinks a week is really where the risk picks up. But
Mhm.
then there's also other studies have shown that like if you have atrial fibrillation and you become abstinent, your burden of atrial fibrillation drops dramatically. So I don't know if we know fully like what level is okay, what's not. But generally, I agree with you. I tell patients the more you drink, the more likely you are to have a recurrence or atrial fibrillation. But maybe there's some evidence that in moderation, definitely less than 1 drink a day would be maybe okay. So
Yeah. And I think, again, we're talking outside of holiday heart here.
we
I
are,
think
yeah, we are, yeah.
which is fine. Great. I've been in some shared visits with Dr. Henry Shaw, and he'll say that, and I've seen this anecdotally as well. Like some of our patients, they can drink white wine and never get AFib triggered, but they drink red
Hmm.
wine, they'll have AFib, or they drink beer and they get AFib, or, they drink hard liquor and they get AFib, but they can tolerate another alcohol, which I find quite interesting that that is what happens. And I think just like every atrial fibrillation is different and everyone experiences it differently, although similarly, every trigger is a little bit different for people, although we do know that alcohol is a trigger for atrial fibrillation, especially at a binge drinking level.
Yeah, I think that's a great point, right? These are studies that study populations. And so individuals may be different. And exactly what you're saying, I think, people react to different substances, alcohol differently. And that's probably why there's conflicting evidence is, depending on the person. And, atrial fibrillation is so complex. There's all sorts of risk factors and there's an interplay between them. It may be different person to person, but in general, yeah, we do know that alcohol is a risk factor, and definitely binge drinking can cause episodes associated with holiday heart syndrome.
Since we're talking so heavily about, alcohol right now, can you explain how alcohol impacts cardiac rhythm?
So I think probably the mechanisms are a little different looking at sort of chronic alcohol use and development of atrial fibrillation and then kind of short-term alcohol use and holiday heart. But we do know that alcohol has a lot of different effects on the heart and the atrium that can lead to atrial fibrillation and other arrhythmias. It changes the electrical properties of atrial tissue. And Dr. Marcus, who we've been referencing, has done kind of a study looking at this, where when you are given alcohol, you basically slow the conduction of electricity in that atrial tissue, and you change some of the properties so that it can't accept new signals quite as readily. So that combination of the slow conduction and not being able to accept electrical signals kind of sets you up for multiple disorganized electrical signals in the atrial tissue that can lead to atrial fibrillation. So that's one thing we do know is it kind of changes those electrical properties in the short term, in the acute setting, and can cause that. It does a lot of other things too. It changes the balance of our autonomic nervous system. So you get kind of an increase in your fight or flight response, the sympathetic nervous system, while you're drinking. And that kind of stress, adrenaline also can increase arrhythmias in general. You get extra beats, premature atrial contractions that can sort of set you up for atrial fibrillation. So it's kind of a multi hit on the electrical system, on the autonomic nervous system. And then we also know over time, alcohol is toxic to our bodies and to our hearts. Both alcohol and its metabolite, acetaldehyde, cause oxidative stress, damage heart cells, and kind of can lead to scarring and fibrosis that also sets us up for atrial fibrillation.
Yeah, that's a good point of how toxic it is actually to our bodies. And one thought that I've had, and actually great to discuss with you, I know alcohol has like dehydrating properties. Like it just naturally causes you to excrete urine. And I wonder sometimes, like, we, when patients come to us for tachycardia and their heart rate is faster and it's like a normal tachycardia, we're like, well, what are the causes of tachycardia? Because that's not really an electrophysiology thing, but it's like, oh, are they dehydrated? Do they have a fever? All the things that would cause that. And so I wonder if that is like a wonderful concert of everything all together that just make the body ripe to have atrial fibrillation. They're a little bit dehydrated. Their autonomic nervous system
Hmm.
is on high alert. They've got this conduction system properties changing, and then they've also like kind of being poisoned. So it's like all
Yeah.
of that. They're like AFib.
That's right. I think so. Yeah, it is a lot of different things happening to the body at once. And you mentioning kind of it dehydrating people from just kind of frequent urination. When we urinate, we lose not only water but electrolytes, and those
Yeah.
electrolyte changes can also put us at risk for different arrhythmias if we're kind of losing potassium in the urine and kind of the levels are kind of shifting and changing. That definitely sets us up for arrhythmias as well. So I think it's kind of this perfect storm of all these things happening that can lead to the onset of atrial fibrillation with drinking.
Are there other common triggers during the holidays outside of like alcohol that patients should be aware of? Not only like being worried about holiday heart, but just like patients with AFib, like could there be other triggers that are happening?
Yeah, I think the holidays are a time of travel and change and stress. And I think many of those things are triggers for people. We know that lack of sleep is a trigger, that sleep deprivation increases your risk of developing atrial fibrillation, recurrent atrial fibrillation. We know that obstructive sleep apnea is one of the major risk factors for atrial fibrillation. So I think that with travel, kind of time changes, stress, people who may kind of have mild sleep apnea can have it worsen over just from the stress and fatigue of travel. All of those things can impact atrial fibrillation. I think we just talked about the autonomic nervous system and stress, like that can be elevated when people are traveling during the holidays or just even if they're home. And then, even with dietary changes, right? I think people end up eating a lot of kind of high salt foods, maybe have higher blood pressures as a result. And those can put a load on the heart and all kind of contribute to the development of arrhythmias. So I don't think it's just the alcohol, even though that's kind of what holiday heart syndrome is referring to. I think there's a lot of different factors during the holidays that can put people at risk of developing AFib and other arrhythmias.
Who do you think is at highest risk for holiday heart syndrome?
It's hard to say about holiday hearts specifically because I think there's a little bit less on this, and it's actually one of the things that I'd be interested in kind of more research around is like predictors of like who might develop atrial fibrillation with binge drinking. But there's a lot of risk factors for arrhythmias in general, and I think they can probably be applied here. We had talked about previously that holiday heart sort of was a new arrhythmia in someone without a history of heart disease. But I do think that this is all kind of on a spectrum, and people who are sort of predisposed to developing atrial fibrillation are probably going to be more likely to have it when they drink and binge drink. And so we know that having heart disease, heart failure, high blood pressure, different cardiovascular conditions puts you at risk of developing arrhythmias and atrial fibrillation. Age is a big one. That's probably the biggest risk factor for developing atrial fibrillation. So I think the older you get, the more likely you are to maybe have atrial fibrillation with alcohol. And then we had mentioned some other ones like sleep apnea, but I think all of those kind of by themselves put you at risk of developing atrial fibrillation, probably predisposed to kind of having holiday heart as well.
With you and I both in clinic over the last month, I have had an increase in patients who have the uptick in their arrhythmia burden. Our nurses are asking, like, well, what were the trigger? They do a great job of like triaging everything as we're managing it. Some of our patients are on antiarrhythmics and like then they're having these breakthroughs of AFib and it's like, oh, they're stressed out or they're drinking more. Like it's that we're supposed to be talking just about holiday heart syndrome, but it's also all these things leading into, like, just patients that already have arrhythmias having a little bit of an uptick around this time or around, times when there's a lot of stress and binge drinking and things like that.
Exactly. Yeah. It's I think like, holiday heart is a syndrome specifically, but also kind of represents, I think it provides kind of an opportunity to talk about like atrial fibrillation and risk factors in general. And I do think that, yes, there's this condition where people drink and might have a first episode of AFib that sort of abates spontaneously, but also, like you're saying, people with atrial fibrillation who might be controlled normally on antiarrhythmic drugs or after an ablation can also have recurrences around the holidays for the same reasons that we just talked about.
Yeah, absolutely. And, I know that, like, we kinda talked about all the risk factors for that, and you discussed how advanced age definitely is a higher risk factor, and that's like a non-modifiable risk factor, right? We can't change someone's age, we can't change their genetics. Is there more susceptibility for atrial fibrillation, depending on whether you're a male or female?
I think probably the data out there shows that men might be more susceptible to atrial fibrillation, but that once you have it, women might sort of experience more adverse effects from it. Atrial fibrillation is associated with stroke, with heart failure, and I think sort of more women with atrial fibrillation go on to develop these adverse effects. But I do think in general, men are a little bit more likely to develop atrial fibrillation.
What symptoms should people watch for that might suggest that they have an arrhythmia?
It's so broad, I think. And, I see people in clinic and it's all over the place, in terms of what people feel. And sometimes you don't always know that, symptoms are due to an arrhythmia until you treat the arrhythmia and the patient says, oh, I'm feeling so much better. This is no longer happening for me. But I think it really spans the gamut. Like, I think the classic symptom people typically think about with arrhythmias is palpitations or kind of having a sensation of heart racing or skipping beats. And that definitely is a common symptom of arrhythmias, but not everyone has palpitations associated with atrial fibrillation and other arrhythmias too. So you might not know, or if you're kind of looking out for that symptom, you could have in let's say atrial fibrillation and you might have palpitations. So I think there's other things that people can feel. I think one common one is just kind of non-specific fatigue, right? Or maybe, hey, like doc, I used to hike this hill every week, and over the last 6 months, I've noticed that I just can't make it up it quite as fast. And that might be the main symptom of new atrial fibrillation is just a little bit decreased energy, little fatigue, feeling a little bit more winded than before. If the arrhythmia is really fast or kind of from the bottom chambers of the heart, if it's ventricular, people might notice some like lightheadedness or even pass out, which is kind of more of a red flag symptom. I think, if we're talking about different symptoms and how worried we should be, I think definitely feeling lightheaded or passing out would be a big one for, hey, like this is serious. I might need to call for help or go to the emergency room. I think those are probably the kind of the biggest ones I would think about, and then of course, if someone has heart disease already, has heart failure, and then they notice that they were doing fine, but now they're like, kind of retaining fluid, not feeling as well, that could be a sign too that there's a new arrhythmia.
Yeah, absolutely. Just also another reminder that we are not providing medical advice in this podcast. We are just providing medical education. You recommended that patients are experiencing dizziness or passing out. That's something that they need to get looked at and maybe consider going to the emergency room, which I think is very very good idea. What if patients are suspecting that they're experiencing an arrhythmia during the holidays? What should they do? Because I know it's going to be really hard for a patient to get in with the primary care. Like, would it be urgent care? Would it be emergency room? And then what signs or symptoms would be more like, hey, this is an emergency and we should have this looked at or evaluated by a medical professional sooner than later?
It's a tough one, but you're right that sometimes there can be just less help available. Getting in with the primary care doctor is harder during the holidays. I think there's a spectrum of arrhythmias, kind of like we've been talking about, and not all arrhythmias are emergencies. So I think that's kind of the first thing I would say is if you're feeling generally okay, if you're having palpitations, but otherwise aren't really experiencing many other symptoms, it's probably okay not present to the ER necessarily. I do think we mentioned some red flag symptoms before with feeling lightheaded or even passing out that would make me worried and kind of push to seeking care more emergently. I think probably if you're having symptoms like like chest pressure or kind of having trouble breathing, especially if you're having trouble breathing just at rest, that's also I would consider that an emergency. I think if you're not having those, if you're not having like, really new kind of chest pressure, shortness of breath, lightheadedness, or you're passing out, you have some time. Maybe it's sending a message to primary care doctor. Maybe it's urgent care. If you're feeling otherwise fine, it's probably okay to wait until that primary care doctor's office is open. We have a lot of new ways of checking to see if you do have an arrhythmia now. And so I think that it's great that people and patients kind of are a little bit more empowered to check for arrhythmia themselves now. And of course, sometimes it's hard to interpret, and you do want to get the advice of a doctor, but especially over the holidays when it can be tough, these strategies for kind of getting an EKG at home rather than going in can be helpful and maybe reassuring, right? If you get an EKG and it says normal rhythm, that can be a helpful sort of sign that you don't have to go and seek emergency medical attention, even if you're feeling symptoms that make you worried that you might be having an arrhythmia.
Yeah, absolutely. I think if you have an Apple Watch or some kind of wearable EKG monitor to be able to take an EKG or a cardia device at home, definitely a blood pressure cuff. I think every person needs to have a blood pressure cuff at home just because as an EPNP, I feel so strongly that everyone needs to check their blood pressure because blood pressure is known as the silent killer. Knowing that, especially if you're having symptoms, you check your blood pressure and that's normal. You get a wearable or a cardiac EKG at home and you can see what that is. And if you have a cardiologist or you have a primary care and you're on my chart, like UCSF Health, patients can send that to their provider and it can be looked at and then things can be escalated. Of course, if there's those emergency red flags like you do not feel well and something is off and you're not breathing well and you're having chest pain or you're dizzy and passing out, then that is an emergency. Last night one of my friends messaged me because they have a family member in town who has a history of AFib, and they went into AFib and they were kind of like, what do I need to look for? And not everyone has a provider as their friend.
I really echo the comment about just having a blood pressure cuff so people can check their own blood pressure. And sometimes it's a matter of, we talked about knowing your body and triggers and kind of understanding what for you raises your blood pressure, and you don't know if you have high blood pressure. So that's definitely a really useful tool. And then I've had a lot of people in clinic come in because they have a blood pressure cuff and, they tell me their heart rates normally are in the 60s. And then one day they were taking their blood pressure and it was telling them their heart rate was 120. That's how their AFib was diagnosed. Definitely, it gives you a lot of information about your health.
Yeah, it really does, and it's a useful tool. So, what practical steps would you recommend that people take during the holidays to reduce their risk of arrhythmia outside of not binge drinking?
It's hard. A lot of the things we talked about are just kind of things that people experience, right? Like sleep deprivation, eating well, drinking. But I think you mentioned not binge drinking, but I think moderating alcohol is important. I think We were just talking about how much alcohol is too much alcohol from an arrhythmia standpoint. And maybe it's just one drink, but I always hesitate to say, like, don't do this or don't do this because, I think we're people and how the holidays are a time of joy and celebration and, being with family. And like, I think people need to live their lives. But in general, moderation is good. And I think that applies for alcohol consumption, but also food. And we talked about salt and other food triggers. I think that is something that people should pay attention to, especially if they have a history of atrial fibrillation or other arrhythmias. And then to the best of your ability, like trying to maintain kind of like a healthy sleep schedule, getting the 7, 8 hours of sleep, being consistent with medications, all of those will help. Just kind of minimizing all the like different stresses to the body, right? Like trying to maintain routine as much as possible within the confines of traveling or holiday plans. I think all that helps.
Yeah, absolutely. So, are there any like common misconceptions or myths about alcohol and arrhythmia that you encounter?
We've touched on this a little bit, but I do find that when I'm talking to people in clinic or just friends and family about atrial fibrillation and alcohol, people are surprised that when I tell them, "Hey, there's probably a very strong linear correlation, and the more alcohol you drink, the more likely you are to develop atrial fibrillation or have a recurrence." And I hear from a lot of people, "Oh, I thought it was just if you drink a lot," which we spent some time talking about how that's not necessarily the case, and people with even moderate consumption can have a pretty high increased risk of alcohol. And that there's some studies that show that maybe abstinence is related to a lot less atrial fibrillation. So it really isn't just heavy drinking that can worsen the risks of atrial fibrillation.
Yeah. Are we doing any ongoing research at UCSF or anywhere else that you know about arrhythmias that are triggered by lifestyle or seasonal factors or alcohol?
Well, we've talked about Dr. Greg Marcus a lot on this podcast, but he does so much great work looking at arrhythmias, atrial fibrillation, and different triggers. And so he just published this huge study recently called Decaf. Oh, we like these fun study names, but looking at caffeine actually and people who have kind of a persistent atrial fibrillation that isn't coming and going, but sticking around, and found basically that caffeine was not associated with recurrent atrial fibrillation after a cardioversion, but maybe even protective. People had less atrial fibrillation if they drank a cup of coffee. So, he's looking at that. I think that there's also some interest with marijuana becoming more and more prevalent and legalized, and that effect on arrhythmias and atrial fibrillation. And he's looking at that now. And I think recently there was some work done by this group too that looked at altitude. People didn't know before. There was kind of anecdotally, patients were like, "Oh, when I go to altitude, I notice that I go into atrial fibrillation." And turns out there is some association between going to elevation and having more atrial fibrillation also. So a lot of great research here at UCSF looking at different triggers for atrial fibrillation.
Yeah, absolutely. Is there anything that you want to see addressed in future studies? Anything that you're like interested in?
Well, yeah. So I think we talked a little bit about predictors of atrial fibrillation, and I think there's just less on holiday heart in particular. I sort of mentioned at the beginning that I had this episode of atrial fibrillation in med school. I have some
Mhm.
like personal interests, and I wouldn't say it was holiday heart syndrome, but I had a couple of drinks the night before and had atrial fibrillation, and it was kind of self-limited. So I think one thing, sort of maybe personally motivated, that I'm interested in is just thinking about this syndrome of holiday heart and kind of lone atrial fibrillation, one episode in someone with a seemingly normal heart, and factors that predict recurrence, right? There's a lot of sort of evolving research that shows that maybe lone AFib or kind of a single episode of atrial fibrillation is not totally benign, and that it may be the marker of a genetic cardiomyopathy or an arrhythmic syndrome. So I think understanding the link and the risks of lone AFib or even someone who develops atrial fibrillation as part of holiday heart and what it means for their long-term risk of developing arrhythmias. I think there's not a lot of data on that, and I kind of interested to see some research on that.
Yeah, that is really interesting. So, if you could distill everything that we've discussed into three takeaways for our average listener, what would they be?
Ooh, there's a lot that we've talked about. I think one, and it relates to the myths that we talked about, right? I think alcohol is clearly a risk factor for atrial fibrillation, and the more you drink, the more likely you are to have it. And that's true of atrial fibrillation in general, and particularly true, right, about today's subject, holiday heart, where even one episode of heavy drinking can really lead to an episode. So that's probably the first. We've mentioned a lot of different holiday related triggers for atrial fibrillation and arrhythmias, alcohol, sleep. And so I think it's important to keep an eye on those and to do what you can to take care of yourself. But also, arrhythmias are a major source of anxiety. And I think getting back to living life and enjoying it, yes, the holidays are a risk for heart disease in general and arrhythmias, and we should do what we can to take care of ourselves. But also, we can't fix everything, and we can't sort of prevent everything. So I think, yes, we do what we can, and also don't let preventing atrial fibrillation be the only thing on your mind during the holidays. Holiday heart syndrome, the traditional definition in someone who doesn't have any heart disease, there's an episode of binge drinking or heavy alcohol use, and then it kind of goes away. But maybe it's not quite as benign as it seems. So there's evidence that could be a sign. So if you do develop atrial fibrillation, I wouldn't just kind of blow it off. And definitely, if you've had atrial fibrillation before, if it's in the setting of alcohol use, I would kind of keep an eye on things and don't lose contact with your doctor or your cardiologist, because it may be that you have other risk factors that predispose to the episode.
Yeah, absolutely. Are there any resources, websites, books, anything like that that you recommend for patients or people who want to learn more? Maybe not specifically about holiday heart, but just about arrhythmias in general.
I do think so. The American Heart Association just released a scientific statement in June about alcohol and heart disease and cardiovascular disease, which is, it's a little bit technical, but I think digestible, even if you're not a cardiologist. I mean, it just kind of walks you through the evidence for the different ways in which alcohol impacts the heart. And then I find that the JAMA patient page is just a nice tool. It's kind of in everyday language. And there are a lot of different topics, not just on cardiology and cardiovascular disease, but definitely, there's articles on pacemakers, what they are, different arrhythmias. And there's often these like great illustrations that kind of help put everything in kind of more concretely. So I think those would be maybe a couple. And then there's a lot of just great articles that are put out by different kind of healthcare institutions, and, Mayo and all sorts of things, and a lot of materials on atrial fibrillation.
So much for sure. Any final advice for patients, caregivers, or other healthcare providers as we are starting to close out this holiday season?
I think just be safe, don't drink too much, and be merry.
Be merry, definitely. Albert, thank you so much for sharing your time with us and for teaching us more about holiday heart, arrhythmias, and atrial fibrillation. It really was a pleasure.
It was so much fun. Thank you for having me.
Thanks for tuning in to this episode of In the Loop with Nadja Wlasiuk. I hope you found today's discussion insightful and empowering. Feel like diving deeper into the topics presented today? Be sure to check out the show notes for references and more helpful information. You can also visit our Substack or Instagram, Facebook, and TikTok. Remember to stay curious and stay informed. Now you're in the loop.